Shay, call 911. Something's wrong with
I'll
Jimmy.
call 911.
I'll get the AED.
I'll call 911.
So what has just happened is Jenny has collapsed. She doesn't have a pulse. Shay has called 911, so EMS is on their way. I brought the AED off from the wall, and in every building at Georgia Highlands is an AED. Be sure you know where your AED is. And so right now I've got the AED here. The first thing you do with an AED is turn it on. And the AED prompts you to do everything.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
The pads tell you where to place them.
Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now.
You must
Press
make
the
sure
orange
nobody's touching the
button now.
patient so that they don't get shocked as well.
Shock delivered. Paused. Begin CPR.
So you begin CPR and you do a rate of 100 to 120 compressions every cycle. There are 5 cycles, which equals about 2 minutes. The AED is timed for 2 minutes, so you should be able to deliver your 5 cycles. And then the AED tells you to stop CPR so that it can analyze the rhythm or not. 2, 3. In the kit is also, or in your AED is a kit where you can shave hair on the chest, because the pads have to be on a bare chest, or cut clothes.
8, 29, 30.
So that's round 2. Fast and effective compressions is actually what the American Heart Association says saves patients' lives. And then delivering the energy to convert the rhythms that need to be shocked are the 2 most important things that we can do.
30.
If you don't want to give mouth to mouth, so it's 30 compressions to 2 breaths. If you do not want to do the 2 breaths, American Heart Association says if you just maintain compressions, that's effective.
30.
You can see when Shay's giving the 2 breaths, I stop compressions so that the air can get inside the lungs. The other recommendation from
Stop CPR. Analyzing heart rhythm. Stay clear of patient.
everybody's clear?
Analyzing heart rhythm. No shock advised. Paused. If needed, begin CPR.
So we will continue CPR, but what I was saying before is American Heart Association says if you need to switch off people doing compressions, do so, because it does make you tired. I hear EMS, so we will continue CPR until EMS is here. And EMS is coming down the hall. In conclusion, cardiac arrest is the #1 killer in adults in the United States. Take measures so that you can prevent cardiovascular disease in yourself. And in the event you witness an unresponsive person, call 911 to get help immediately. Know where your AED is in your building and start CPR immediately. You can make a difference.